Hello, friends, and a very warm welcome to today's KK May Talk show, the Barrow Buddy show. And today we are going to discuss something really, really important. Today is our 1193rd episode that we have. And today we have a special theme or topic for today, and that is what everybody is talking about. Well, friends, today we will talk about semaglutide price crash. What are the facts? What are the policies? What the consumer needs to know. So, yes, so in this next 25 minutes or so, I will take you through some of the commonly asked questions by the patients, by the media, and everybody who needs to know about semaglutide. So I will take you through these questions. So I'll take you through these questions one by one, the commonly asked questions, what everybody is talking about, and what is this semaglutide price crash all about? Well, what we learn is that semaglutide has been a drug. It has been there for over 10 years in the market abroad and was launched in India earlier this year. But what has happened is that this drug has now lost its patent. What does it mean by losing its patent? Losing its patent means that now, apart from the innovator company, other companies can also make this drug, and which, in a way, has made the prices of this drug come down dramatically. So, on an average, a patient who is using semaglutide was spending somewhere around, maybe when they reach the maximum dose or the appropriate dose for them, was spending about 10 to 20,000 rupees per month on this injection, and that is a fairly high price for anybody to pay in an Indian setting for obesity or diabetes management. But as of 21st of March, once the patent for this drug has been over, this drug has really become low in their cost, so much so that the prices have really come down one tenth. And what was 15 to 20,000 is now something like about 2 to 3,000 rupees per month price. So that sounds very, very cheap. But today, friends, we will discuss what are the advantages, what are the disadvantages, and what we need to be careful about, and what all of us as physicians, as patients, as people, as responsible citizens should know about this change. And I'm glad that people have joined in to listen to this particular important discussion that we are having. You look at social media, you look at newspaper, you look at news, everybody is talking about it. So, yes, let's talk about the good things first. So, definitely, the deal is big because something which was elite, something that was available for a larger community or just the rich community has now suddenly become affordable for the common man. And on an average, we do have medicines for usage for diabetes, which range from anywhere as cheap as around 30 to 40 paisa per tablet to as high as about 300 rupees per tablet. But now with the injection, this has really, really become cheap. So, what are the advantages or the good points about this? And definitely, more and more people can now afford, can now buy this medicine for management of type 2 diabetes and obesity, and can realistically start. Earlier on, when I had to prescribe this medicine, I had to bring up the issue of cost to my patients because these are not drugs that are just one time use. These are not drugs like antibiotics that I'm going to use for 4 or 5 days and then it's fine. These are drugs that need to be taken long term, exactly like you take your thyroid medicine, your blood pressure, your diabetes medicine. Similarly, these medicines also need to be taken for a very, very long time. So the good point is, yes, a lot more number of people can buy it now. So it's more affordable. It has reduced the economic disparity between people. So earlier on, it was only the rich could afford it, and those who could not just get it. And the other advantage of the semaglutide price crash is that now, given that the monopoly of one company making it has gone, close to 30 to 35 Indian companies have come up with making of this drug, and which means that there is some competition. There is some there's competitive pressure, which is good for the Indian market, which is good for our patients, because now one company would try and lower the cost than the other, trying to make sale, and therefore our patients are going to get a lower and a better deal for using these medicines. So these are very good points about this price crash that we all know about. But are there any risks? Are there any fallacies? I think that is the more important point that I really want to discuss today. So now it's cheap. So should everybody be taking it? And that is the wrong message that is floating around in social media. And I think it is important not to ignore the contraindications, the indications, the risk benefit ratio, and how this particular drug is really not for everybody. You need to find out your friendly neighborhood endocrinologist, your treating physician, who would decide whether this drug is actually okay for you or not. There are very specific indications. Also important to remember that it is the same molecule, but are all the products automatically equal just because the name is same? Yes, the drug is the same. It has been manufactured separately in a different way. The quality, the formulation, the device, the pharmacokinetics, how this drug actually works may be slightly different between the different brands. So again, it's not something that you decide in your room, in your mind, not as a specialist to take it. Also, another important fallacy, which is, I think, trending now, is whether weight loss without lifestyle is an option with this drug. And the answer is a big no. Is this drug a replacement for your exercise? Is this drug a replacement for your diet? The answer is no. This drug has to be taken with lifestyle management. You need specific lifestyle advice for continuing this medication, because you need to know what are the nutrients that you're going to be lacking by taking this medicine, what is your muscle mass going to be, and how you're going to preserve your muscle mass and not let it lose along with your fat. So you see, there are nuances, there are specifics that we need to know about this drug. And it's not that it is cheap, so everyone should take it. It's not that it is a replacement for lifestyle. So this brings me to the next important question. Is generic semaglutide same as the innovator? Well, as far as the active molecule is concerned, the answer is yes, same. But again, as I mentioned, the excipients, the pen design, the stability, the injection experience may differ. Today, we have it now as available as a vial. We have as a one-time use pen, as a reusable pen with a refill. There's so many different pens, there's so many different formulations. Each of them have to be learned separately, and all of them are definitely not the same. Moreover, we need regulatory approval, which has been got for many of these drugs, but that depends that these drugs should be tried and tested with the innovator brand to know whether this is actually equal, whether the type of data is similar, and a lot of learning will happen in the next couple of months, whether the real world data tells us that this is the same effects that we are seeing as we got with the innovator or not. And the quality also depends on the manufacturer's track record. And I think, therefore, very, very important is the pharmacovigilance. Also, as we approach summers, the cold chain integrity is also very, very important. The cold chain is important because this drug may be stored in a small pharmacy in a refrigerator where there's load shedding and there is no electricity for 12 hours. Well, once the light comes, the injection will again look cold and look fine. But inside, what damage has happened because of the breakage of cold chain, you will never be able to find out. So again, reliable manufacturer, reliable pharmacist is something which is important. The device reliability is also something very important. You may click and it shows that you have taken X amount of the drug, but is it really delivering that much amount? Has this been tested? Again, is something important. So again, as you see, there are so many nuances that we need to know. So how will your doctor decide whether the innovator or the newer, cheaper semaglutide is the better one? Well, affordability is one aspect of it, but again, it depends on a discussion that your doctor will have with your patient. It's not that the doctor will decide which is just the best for you, or the patient would ask and say, this is the best for me. I think as we talk more and more of person-centered care, I think we would be sharing this information with the patient and then decide as a common decision, both as your doctor and your patient to decide which one you have to take. Also, some points that we need to often tell our patients, because some patients have this mindset that if it is cheaper it may be lower quality. If it's cheaper I can play around with the doses myself. If it's easily available I can stop it abruptly without any consequence. So these are three of the important points that I really want to highlight in this talk show today, that is not important. If it's cheaper it need not be lower quality. We've used other forms of generics in the past for other medications, and sometimes they could be as good or maybe even better in quality as the innovator brand. But definitely, if it's cheaper, you cannot play around with it yourself. You cannot decide how you're going to increase the dose. You change the dose suddenly without your doctor knowing it. You might land up in trouble in terms of the side effects, and you might land up in the emergency. So you don't do it yourself. You consult your doctor before changing any such dose yourself, and you cannot play around, and neither can you stop it by yourself. You have to ask the doctor. And that's what is the real worry in today's Indian scenario. As this drug has become really, really cheap, I think we need to know what kind of misuse we are really worried about. It's not a quick slimming drug. It's not something that's going to be that should be sold in slimming centers and gyms. It's not to be sold in saloons. There also I've seen the advertisement. So I think very, very important that you need a medical prescription to buy this drug. Very important to make sure that you consult your doctor before you take this medicine, because it's not so straightforward. These are serious medications. They're very effective, they're very helpful, but your doctor needs to see whether this drug is safe for you, what are the indications, what are the contraindications. All of that needs to be really, really made sure. And there are clear guidelines as to who you can start this medicine and who you cannot. And definitely, you don't want to be on the wrong side of your health just because you decide that this medicine is okay for you. So please, please, please make sure you do not take it just because you want to take it, but do consult a specialist who is going to be able to assess whether this is the right decision for you or not. Are there policy level implications that have happened? Yes, because of these, all the worries that I shared with you, our national government and pharmacovigilance team has come out with very strong messages in the last 2 or 3 days, which tells that all these drugs need to be very carefully monitored, regulated. Their sale has to be monitored, should be with a proper prescription. Again, very, very important to collect data after this drug is being used in the real world scenario to see how is the impact. And therefore, that will further tailor on and decide whether these drugs are going to stay here for long and whether their effect in terms of their efficacy as well as the effect in terms of side effects is similar to the innovator brand or not. But yes, pharmacovigilance, it is important, and we have to collectively, as responsible citizens, reduce the misuse of this drug. And therefore, it should be given only in a prescribed fashion. Now, many times patients would come and say, Doctor, what are the important side effects of these medicines? What will happen if I really take it? And believe me, half the time in the OPD goes convincing patients who need this medicine to take it, whereas the other half goes convincing patients not to take it who don't need the drug and have just come to consult just because they want this prescription. Well, it is to be discussed, and there are side effects that need to be known. Especially the most common one are the gastrointestinal side effects. There could be, depending on how you tolerate it, what is your dose and how it's been titrated, how is your response been to previous GLP-1 RAs, and what your other metabolic parameters are, your side effect profile may be different. But yes, there could be contraindications. There could be contraindications based on absolutely unrelated to the weight, contraindications unrelated to your diabetes value, and these contraindications your doctor would need to assess. And there are absolute as well as there are relative contraindications. And more importantly, once you start this drug, it is important to monitor as well. And therefore, there are a lot of points that you need to know when you start this drug. If I was to highlight a few important points in people who start this drug, I think the first and the most important message here would be that this is not a short term therapy. This is a long term therapy where people need to take this medicine long term. As I said before, like diseases like thyroid, diabetes, hypertension, those medications are taken for long. And similarly, this medicine is for chronic disease management. It is not something that you take for 3 months just because you want to fit in to a wedding suit for a particular event. And then you think that, okay, I'll take this medicine for this time, get slim, and not bother what happens after that. But after that, you might rebound your weight gain. You may lose muscle and gain more fat and land up even more metabolically unhealthy and with more problems than where you start. So it is very, very important to understand if you are starting this medicine, this is not a shortcut. This is not for short term. We're looking at it for a long term perspective of its use. I think it's also important to clarify that dose escalation when you start this medicine has to be very gradual. Many times, people in social media would have heard that this drug would cause so much weight loss at this particular dose, and you want to get to that dose as soon as possible. Well, friends, that's not the right way. You have to escalate gradually. It's depending on the tolerability of these patients, depending on the GI side effects of these patients, that you have to escalate this drug. It cannot be escalated very rapidly, and we do not advocate to escalate it very soon. What is also important if you've started this drug, as I mentioned before, you have to reinforce what your lifestyle is going to be. At times, people who are taking these medicines would come and tell me, Doctor, yesterday I forgot to eat my breakfast just because I was so busy in office. I just did not realize and I was not hungry. And that is something that we need to avoid. All along in these patients with obesity, I've been telling them to eat less, but then now when they are not feeling hungry, they have just not eaten. But that's not important because you need some amount of bare minimum vitamins and minerals for your cells, for your body to function normally. And if you stop eating your meals, you're going to be able to eat very little. But if you're going to stop eating your meals completely, you might get more malnourished. So, what is really important is to eat on time, eat good quality food, and not skip your meals because you'll never be able to make up for that meal that you have lost because you cannot eat more in your second meal. So, I think diet quality, physical activity, and other lifestyle measures are like your sleep, good mental health. I think all of that is also very, very important. I think another very big question that is often asked in the clinic is what about those patients who are already on the innovator brand or sometimes even on another drug like terzepatide, which is not semaglutide, but is another weight loss drug which is not yet off patent and therefore is expensive. Can they be switched to semaglutide? And a lot of patients are asking that because that is hurting the pocket, and now there is something which is cheaper, which is available. So I must say that the mechanism of action of these two drugs is different. The weight loss with tirzepatide is definitely much more than semaglutide. However, whether we are able to switch this or not would specifically depend on your profile based on your glucose and your weight outcomes, and also the tolerability of both these drugs may be very, very different. We may have much higher upper GI side effects with semaglutide, but maybe lower GI side effects with tirzepatide. And again, it is your treating specialist and physician who should decide whether you can switch or not. And again, at what dose you need to switch. Are you on a higher dose of tirzepatide? Doesn't really give you a license to directly jump to a higher dose of semaglutide. Again, this has to be decided on case-to-case basis, and it would be decided based on what your physician would tell you. Another of the questions that is often asked in the clinic is what about the oral tablet of semaglutide that is available? And the oral semaglutide has been available in India for a longer period of time. A lot of patients are on this medicine, though this medicine is really costly. It costs about 300 rupees per tablet. But yes, even the price of this medicine is going to come down. But that is mainly for diabetes management. It does not cause as much as weight loss and the injectable version would cause. And therefore, it is important that it's not just the same that you suddenly switch from an injection to a tablet. However, yes, The tablet also causes weight loss, but it's only to the scale of 4 to 5%, is what the data that has shown to us. So, friends, this is what I really wanted to convey to you in this message when you talk of semaglutide price crash. What does it mean for all of us here? And I think some of the main messages that I would like to leave you with this particular talk show today is that definitely semaglutide is becoming cheaper. It's a huge opportunity to bridge the gap between those who are affordable and those who are not so affordable in the management of diabetes and obesity care. But it should be used judiciously. It should be used under metabolic and good supervision. Generics are not automatically inferior, so definitely we can't say the cheaper it is not work. It's not good. But then again, at this time, we need more quality regulation, pharmacovigilance, and proper medical supervision, no matter what and who is prescribing you these drugs. And for those who are considering a switch from one type of a drug to the other, the decision has to be individualized by your trusted clinician, and do not go just by price, and definitely do not go by social media trends. So I think this was the main aim or the crux of today's session. I would stop my discussion here. I see a few comments in the chat box, but thank you so much for joining. And I think this is all that I have to say today. Thank you very much.